Everyone, myself Dr. Namrata Vithalani. In this video, I will give you brief information regarding the anti-tubercular drug related hepatitis. So whenever the patient has been initiated on the first line anti-tubercular drugs, that is isoniazid, rifampicin, pyrazinamide, ethambutol, out of this isoniazid, rifampicin and pyrazinamide, they are hepatotoxic. So whenever if patient is on AKT, we have to explain the patient on discharge or when you visit the patient that if you have to report immediately if they report the symptoms like persistent nausea, vomiting, decreased oral intake or fatigue, or there is icterus, yellowish discoloration of the sclera and dark color urine is there, or altered sensorium. So basically the manifestations of hepatitis or abdominal pain, so they have to report. We have to check the LFT, and if the liver enzymes are elevated or the bilirubin is elevated, if the liver enzymes SGOT, SGPT, they are elevated 3 times of the upper limit associated with the symptoms as I described, like vomiting, nausea, abdominal pain, jaundice or altered sensorium, fatigue, or if patient is clinically asymptomatic, still if during follow-up you see the 5 times of upper limit of the normal elevation of the liver enzymes SGOT, SGPT, or bilirubin elevation more than 2 mg per deciliter, it is considered as the drug induced liver injury, that is the anti-tubercular drug induced liver injury. In such patients we have to if the anti-tubercular therapy it is non-urgent, we have to immediately stop the anti-tubercular therapy, and we have to consider the alternative drugs which are non-hepatotoxic. Out of the first line drugs, ethambutol, or we can choose along with that we can use one of the fluoroquinolones like levofloxacin or moxifloxacin, and among the among the aminoglycosides we can use the either streptomycin or amikacin. So first we have to confirm the diagnosis of drug induced liver injury. We have to rule out the other causes, like we have to order for HIV, HBsAg, then anti-HCV antibody. We have to screen for the USG abdomen with pelvis. We have to look the coagulation profile when the liver enzymes are elevated, hepatitis panel, anti-HEV, HEV, according to the clinical suspicion and symptoms. So if we label that this liver enzyme elevation or bilirubin elevation or the symptoms they have been attributed to the anti-tubercular drug, we have to stop it and consider the alternative options like ethambutol or one of the aminoglycosides or fluoroquinolone, and after 1 week we have to repeat the LFT, and if we do see the normalization of the LFT and improvement in the symptoms, we can one by one introduce with the least hepatotoxic agent like rifampicin, after 1 week isoniazid, followed by pyrazinamide. And according to the which anti-tubercular drug we have selected, the and according to the regimen, the duration of the anti-tubercular therapy we have to decide. Thank you.